I've been a nurse for many years now, probably close to 35 years. And I don't know, I can't really say what brought me to nursing, but I've always wanted to be a nurse. I always tell my students that I never, even over all the years, and that I've never really wanted to be anything else but a nurse. Prior to being a registered nurse, I was a licensed practical nurse. And as soon as I graduated from that, I knew that I wanted to do something more. So I did the diploma registered nursing course. And then I moved to Los Angeles and worked as a nurse in Los Angeles for 10 years. And then I came back to Toronto and moved out here, and I took my Bachelor of Science in Nursing and then my Master's in Adult Education and then my PhD in Educational Administration. The dean and myself and a small team went down to Santa Barbara, California. That's where the telerobotics began at InTouch in Santa Barbara. Again, we went through everything and looked at everything, and now how could this work in nursing and that sort of thing. And it just so happened that the course that I teach in particular physical assessment, that would probably be the first course that you would start if you were going to use a robot, because it probably, of all the years that I've taught, that course probably lends itself the best to using that technology because of the actual physical skills that are involved in that and the way that you can use the technology. The course that I teach, as I mentioned, physical assessment and components of care, the theoretical piece is done for 3 hours via video conference, and then the part that we use the telerobotics for is the laboratory component, so the practical application of what the theoretical was about. So it sort of works out perfectly because we do that in the morning and then we go to the afternoon session and we take what we've sort of talked about in class and then sort of apply it in the lab setting. So we do systems assessments. So if we are doing, say for example, the respiratory, so the lungs and thorax, so we've talked about all the sort of anatomy and physiology pieces of it in the morning and what the actual hands-on piece looks like, but then in the afternoon we actually practice it. So after we've done our quiz, then with me just sort of using the robot then just as a, I guess as a just face to face, just talking to them. In Isle of Crass, I have 4 students, so I'd have 2 groups of 2, but in L'Orange I have 10, so I'd have 5 groups of 2, so I would just sort of drive my rote-like side, go down to each bedside and talk to them, and they talk to me, and if I have to show them something, I can zero in, or they can show me, is this right, or whatever, so that's really what it's about. We do this gold standard of physical assessment examination, and they do that in medicine, they do it in social work, they do it in physiotherapy. It's called the OSCE, the Objectively Structured Clinical Exam. We did the OSCE in Isle of Crass and then in L'Orange, and we were 100% successful on the first go-round, and that's, in all my years, that's a first. It's not just about sitting there and depositing information. You want them to actually learn it, especially in something like nursing where the end result is that they're responsible for somebody's life. So you want to make sure that they know, it's not just that they memorized it, but how can they actually use it in the hospital or wherever they might be.